So now moving a little closer to home, Chapter 9 looks into health and disability income insurance. And as we're moving ahead, we're still looking at fixed expenses in terms of at least theoretically the costs don't change month over month. We know pretty much what those costs are going to be. So these are fixed expenses again. So onward we go. So objective 1, recognize the importance of health insurance and financial planning, absolutely imperative. Analyze the costs and benefits of various types of health insurance coverage, as well as major provisions in health insurance policies. Assess the trade-offs of different types of health insurance plans. Okay, so again, we're evaluating health insurance, and the reason that we're going through this is because health insurance is an enormous cost that we spend probably 20% of our income on health insurance as a nation, on health care costs, etc. Whether we're in toto, so it's an enormous expense. It's probably on par, maybe even more than the cost of mortgages, etc. Not quite, but yeah, you get the idea. It's right up there near the top. Onward, evaluate the differences among healthcare plans offered by private companies and by government, explain the importance of disability income insurance and financial planning, and identify its sources, explain why the cost of health insurance and healthcare have been increasing. This goes back a few years, but nonetheless, it's continued on that same trajectory. It's increasing amazingly. It's increasing by a huge amount. So health insurance eases the financial burden people might experience as a result of illness or injury. It takes a load off people, knowing that you have some health insurance, some coverage. It includes medical expense insurance, disability income insurance. That's primarily what we're talking about with this health insurance. So there are different types, of course. The big umbrella groups we're looking at, well, we'll start with group plans. Covers most individuals, usually employee sponsored. So if you're employer sponsored, rather, if you're working for someone, oftentimes you have health care options for purchasing health care or getting some sort of a benefit, health care benefit from your employer. The HIPAA laws, Health Insurance Portability and Accountability Act of 1996, establishes federal portability standards for your health care coverage moving forward. If you change jobs, you don't need to lose your health insurance. You can continue to pay for the premiums through wholly on your own. It's on your dime, so to speak, through COBRA, etc. Group policy supplements, coordination of benefits. The benefits received from all sources limited to 100% allowable medical expenses, meaning usually when we talk about coordination of benefits, that has to do with coordinated with your insurance, for example, like your auto insurance, individual health insurance. Then there's the COBRA that I mentioned before, and I don't even know what that stands for, but it was established in 1986, and it offers the option of continuing on with that group coverage for, it says a set period. I think it's a year or two if you're laid off from a company or fired or let go or whatnot. Of course, you have to pay the full freight, so it can get very expensive. Types of health insurance coverage: basic, major medical, and both. Okay. So basic health insurance is hospital expense insurance, hospital room, board, and other charges. Surgical expense insurance, surgeon's fees for an operation. Physician expense insurance pays for physician's care that does not include surgery, such as office visits, lab tests, x-rays. So that's kind of the breakout. The actual hospital expense, the surgical expense, they related directly with the surgeon that is doing the operation, and then all the other physician, if you will, expenses that are associated with everything but for the actual surgery. Basic health insurance, major medical expense insurance covers expenses for a serious injury or long-term illness. So again, this is major medical expense. May include deductible, co-insurance, stop loss provision. It goes on and on. Deductible means that you have to pay a certain amount before you don't. So you have to pay the first X amount of dollars, and after that, with some co-insurance shared costs with yourself and with your insurance company. And after that, you reach your limit, then everything is going to be picked up. The tab is going to be picked up by your insurance. Comprehensive major medical insurance, low deductible, offered without a separate basic plan. So all this thrown together covers hospital, surgical, and other bills. There are always deductibles involved, but nonetheless. Hospital indemnity pays you a fixed amount for each day you are hospitalized. Does not cover medical costs, supplement to other plans. This is often through such things as AARP, for retirees and so on and so forth, where it picks up additional, it pays you some additional funds, if you will. Also, there's dental expense insurance, and that's through like Delta Dental, etc., where typically it covers exams, cleaning, x-rays, fillings, root canals, oral surgery to a point, but usually they typically don't cover as much on the dental side of your expenses. They do typically cover exams and cleaning, x-rays, not so much so far as the actual dental work that's done. Vision care, exams, contact lenses, glasses, limits on that. Dread disease policy pays off very specific conditions, legal in many states. Aflac is what's cancer coverage. And at any rate, these are set up for very specific cases. Long-term care insurance, something that's very popular. Makes sense for those with a net worth of $100,000 to $2 million. Covers daily help if seriously ill or disabled, nursing home or in-home care. And this is long-term care. So after 24 days, if you're, grandma's in a nursing facility, goes to a nursing facility, or you will eventually yourself, the costs are unreal. Don't even realize that the costs are just enormous. This is where the long-term care comes into play, long-term care insurance, where it offsets some of that cost. And these are plans that have been very popular, and they've kind of lost some of their luster of late, but they're still very popular out there nonetheless. Major provisions in health insurance policy. Eligibility varies with age, marital status, dependency, assigned benefits, insurers pay your doctor or hospitals directly, internal limits, fixed amount per day for a hospital room, and those are the limits that are set. Major provisions, again, co-payment, cost sharing in the form of a flat dollar amount that you pay, such as $15 per office visit or $10 per prescription. Typically it's more than that, of course. Probably today it's probably $25, $30 per office, and probably more on the order of $20 per prescription that your copay is. And service benefits, entitlement to specific services that would be associated benefit limits, maximum dollar amount, maximum number of days in the hospital, for example, maximum that the insurance company will pay out, period, health insurance. Exclusions and limitations, pre-existing conditions. This is something that's got a lot of play, pre-existing conditions. And that's something that's a major stumbling block so far as a lot of insurance is concerned. It's kind of on the way of being addressed. Cosmetic surgery, limitations there to a point. Some cosmetic surgery is acceptable if it's just to get a tummy tuck or get your chin worked on, so on and so forth. That would probably not be covered by your insurance, for example. But there are some cosmetic surgeries, for example, mastectomies, the cosmetic surgery to reconstruct breasts, those are acceptable, and they are covered typically. Cancellation termination explains the circumstances in which your policy can be canceled. The trade-offs in choosing a policy: reimbursement versus indemnity. Reimbursement pays actual cost. Indemnity pays specific amounts. Internal limits versus aggregate limits, deductibles and co-insurance, out-of-pocket limit, benefits based on reasonable and customary charges. I think it's UCR, usual and customary charge. Anyways, reasonable charges, meaning that they are willing to pay a certain amount and no more. And so your doctor has to either agree to this up front, that they will accept that payment from the insurance. Whenever the insurance sets up, they agree to pay $1,000 for a procedure, and your doctor wants to charge you $2,000 for a procedure. If the doctor is connected with the insurance company, they can only charge $1,000. If they're not, then they can charge you $2,000, and if they're out of network, for example, insurance company covers the $1,000, and you're on the hook for the other $1,000 plus whatever co-insurance, co-payment, deductible would be involved. So the health insurance plan, again, should offer basic coverage for hospital and doctor bills, provided it's 120 days hospital room and board in full. So it wasn't 24, it was 120 days, excuse me. Should provide at least $1 million lifetime maximum for each family member, pay at least 80% for out of hospital expenses after yearly deductible of $500 per person or $1,000 per family, impose no unreasonable exclusions. There's a whole list here. Of course, this is older, so these numbers have changed significantly. Limit your out-of-pocket expenses to no more than $3,000 or $5,000 a year. Typically, it's quite a bit more. Excluding dental, vision, those are usually different policies. Dental policy, vision, and prescription costs are under separate groupings. The difference between or differences among healthcare plans offered by private companies and by the government: private healthcare, private health insurance, individual policies, group policies sold to an employer, so at your behest. Hospital Medicare service plans, typically through Blue Cross, hospital care, Blue Shield, surgical and medical services. Interesting. I had never known that breakup before. So Blue Cross is the hospital care, Blue Shield are surgical and medical services. So again, that's the Blue Cross Blue Shield umbrella, if you will, in terms of healthcare coverage. HMO or health maintenance organizations, managed care plans, where you have a primary care physician who directs you to all the other areas that you have to go to, specialists and so on and so forth. There's a fixed prepaid monthly premium, focuses on prevention and wellness, basic and supplemental services. And they tend to be pretty stingy because anyways, it's the whole idea behind an HMO. Preferred provider organization keeps people under the umbrella that the providers are all within that same group or that same area. And typically you have more latitude, you've got more options, but than with an HMO, and so the costs are typically a bit higher. More choices, again, fewer restrictions, but you still want to stay with one of your PPO providers, the people that are in the network, if you will. Point of service, POS, combines features of HMOs and PPOs, HMO/PPO, hybrid or open-ended HMO, all different combinations of types of health insurance. Home health care agencies, medical care in a home setting for a fraction of the cost of hospitals, employers self-funded health plans. These are companies are taking care of their own insurance, and typically they're run through companies like Blue Cross and Blue Shield. They're the administrators of the plan, and the costs are actually within the company itself. HSAs, HRA, FSA, the health spending accounts, HSA, money contributed tax-free, HRA, health reimbursement accounts. These are tied to high deductible policies funded solely by the employer. Unused funds carried over to next year, so it stays in your account going forward. Flexible spending accounts, FSA, pre-tax dollars, and funds managed again by the employer, and unused funds are forfeited at year end. So You either use it or you lose it, in other words, okay? In comparison of those, of the HSA, FSA, and the HRA. The HRA, the difference is with the HRA and the HSA, you're looking at high deductible plans in particular, whereas the FSA is not necessarily tied to a high deductible plan. But again, with the HSA and the HRA, these are the funds you get to keep. HSA, you can carry them with you to another plan, if you will. HRA, you can keep so long as you're staying with the same company. If you leave the company and you have unspent funds, then those are forfeited. Government health care, Medicare, different parts of Medicare. Again, this is for people that are 65 years and older. It does not cover everything. Patients are liable for whatever the difference is, and these are the 4 parts. A is the hospital insurance that we were referring to before. B would be the medical insurance. C would be the Medicare Advantage plan, and D would be the prescription drug coverage. So, Part A, hospital insurance pays for inpatient care in a hospital or skilled nursing facility following a hospital stay, some home health care, and hospice care. Part B, medical insurance pays for doctor's services and many other medical services and supplies not covered by hospital insurance. So this is kind of an addendum, an add-on, if you will, to Part A. Part C, those with Parts A and B can choose to receive all their health care services through one of these provider organization under Part C. Again, Medicare Advantage plan is available in many areas. Those with Parts A and B can choose to receive all of their health care services through one of these provider organizations under Part C, okay, through the Medicare Advantage plan. Part D has to do with your prescription drug coverage, helps to cover the cost of your prescriptions. Medicare Choice allows choice of managed care plans in addition to Medicare coverage. Medigap, Medicare supplement insurance policy. Private coverage fills gap in Medicare Parts A and B. So this is typically you would be buying an additional rider through some other company, some private insurer, if you will. And this walks through the comparison of those with the Medicare plan comparison. So it may not be important to you at the moment, but these are all things that we all have to deal with at some point as we get older, and if not for ourselves, then for our loved ones, for our parents, grandparents, etc. Medicaid is medical assistance offered to certain low-income individuals and families administered by the states. It's a block grant that comes from the government, from the federal government, and it's sent to the states, and the states decide how to administer. Typical benefits are physician services, inpatient, outpatient, hospital services, the same type of stuff as with Medicare, prescription drugs, eyeglasses, and preventative care, if you will, for those under 21. And here's a list of the different places where you can go for health insurance information, if you will, that's available. Health insurance, the Patient Affordable Care Act of 2010, aka Obamacare, a few of the key plan provisions, and all these things are constantly changing. Tax credit to small business to offer coverage, prohibits denying coverage to children with pre-existing conditions, temporary high-risk pool for uninsurable folks, eliminates copays for preventative care, for such things as mammograms, for colonoscopies and things that you would have to be going forward to do regardless that are preventative in nature. Allows young people to remain on parents' coverage to their 26th birthday. Prohibits lifetime caps on coverage. Requires most to purchase insurance. Most people are compelled to purchase insurance, or at least theoretically. All this has changed. The ACA, again, an individual shared responsibility. Individual shared responsibility provision requires that individuals have minimum coverage, have an exemption, and make a shared responsibility payment with their taxes. So you're identifying this and contributing on your tax, acknowledging and contributing via your taxes. Minimum essential coverage options. This is where we talk about the bronze plan, the silver plan, the gold plan, and so on and so forth. You may be exempt if you have no affordable coverage options because the minimum annual premium exceeds 8% of your income. That's one. Have a gap in coverage for less than 3 consecutive months. Qualify for exemption for one of 3 reasons, or one of several reasons. Hardship, belonging to explicitly exempt group that we've kind of the aforementioned above. Disability income insurance, originally designed to protect against loss of income. Young, healthy people don't consider the risks associated with to their future earnings potential. Provides regular cash income lost by employees as a result of an accident or illness. So this is disability in the event that you are disabled as a result of some accident or other, if you will. Moving on, workman's compensation. These are again government plans. Disability from on-the-job accident or illnesses is paid by your employer. Other employer plans that would be available to you would be short or long-term group disability policies. Typically, the short-term group disability is something that employers pick up. Longer term are things that you would typically, you the employee would be paying or at least sharing in the cost of a long-term group disability policy. Social Security, again, covers total disability lasting more than 12 months, starting in the 6th month. It takes a while to collect, to qualify for it, and oftentimes people have to apply for disability more than once. It's something that can cause a lot of hardship for people, but at any rate, private income insurance programs supplement other income sources. Normally provide 40 to 6% of the income. So it's kind of it's kind of a tack on, if you will, an add on to those Social Security disability payments. So it makes you it gets to the point where you're replacing all of your income, if you will, when you're looking at that, the private insurance programs for disability, etc. Insurance trade-offs, policy definition of disability. It can be very specific, and waiting or the elimination period, waiting for that income, or that the payments. It can be dragged on for quite a while. Duration of the benefits, the amount of the benefits, accident and sickness coverage, because you still need insurance after you're disabled. Guaranteed renewability is not necessarily the case. You have to go through processes in order to do this. So disability income needs, sick leave, short-term disability, group, long-term disability, Social Security, other government. This goes through the entire laundry list, and coming up with the income, trying to replace that lost income, if you will. Healthcare cost accounted for $3 trillion. U.S. has the highest per capita healthcare cost of any country in the world. A lot of reasons for that. A lot of decent, good reasons, a lot of reasons that aren't so wonderful, but nonetheless, we have the highest per capita, the highest per person healthcare cost of any country in the world. Rapid increase in medical expenditures, 17.7% of GDP in 2011. Again, 18% of the overall gross domestic product was spent on what? Healthcare and medical expenditures. Expected growth of 5.8% annually through 2022. So I'm not sure what it's at right now, but it's probably darn close to 20% or higher, if you will. There are very high administrative costs. Again, these are problems that are associated with this. What's driving this? 26% of healthcare costs are coming on the administrative side, not people providing, but people that are providing for the people that are providing, if you will. So cost of office help and so on and so forth. Reasons for high healthcare costs, sophisticated technology. So we're adding more technology. People are living longer, presumably better. duplication of tests. Physicians, to cover their own backsides, are often driven to have blood work over and over again, to do these things over and again because they're trying again to protect themselves against being sued. Variety and frequency of treatments, that's increased significantly, increasing number and longevity of the elderly in general, that group of people that are in that older cohort because of baby boomers and the like, increasing the numbers of the pool that's out there, increased regulations, increase in emergency treatments, people going to the emergency room for things that in the past they may not have for a variety of reasons, including not having insurance and so on and so forth. Limited competition, especially in the case of probably post 2008. What's happened is that there's been a lot of consolidation within the healthcare industry, where before you would have lots of doctors' offices and you would have a hospital. Now you have very few doctors' offices that are not associated directly or indirectly with hospitals, meaning that a lot of this is driven through the hospitals, a lot of the healthcare is driven through the hospitals, and the competition has fallen significantly. Rapid earnings growth, again, for healthcare professionals. Go through any hospital, and what you'll find is you'll find enormous, incredible numbers of vehicles that are $100,000, $150,000, $200,000 vehicles. It's just amazing. And that's because of the professionals, the administrators, but also the actual physicians and healthcare professionals are earning a lot more money than they have been in the past. Their wages have gone up significantly. Using more unnecessary medical care. Again, this is part and parcel with it goes part and parcel with the duplicate tests. Built-in inflation in the healthcare system. Again, back to what we said before, aging baby boomers. It's an increasing size of the number of people that are out there that are in need of more healthcare, better healthcare, taking advantage of those sophisticated technologies that were not there before. Other major factors include fraud, waste, and the cost of malpractice. You'd think that the malpractice was a large component of this, but the fact is that it's not quite as large as I was led to believe at one point, at any rate. It's pointed out to me by someone. What is being done about the high cost of healthcare? Reviewing healthcare fees, incentives to encourage preventive care, community health planning, prepaid group practices, which is an interesting one. But community health education programs and paying cash. In other words, you go to a doctor's office and you can negotiate. People don't realize this. If you bypass the insurance, doctor may negotiate upfront at a lower price, or they typically do. You have a procedure that if it goes through insurance, they're going to bill the insurance at $2,000 for this procedure, knowing full well that the insurance company is only going to be paying $1,000, but they still nonetheless bill $2,000 because that's the way they operate. Insurance pays the $1,000, and it takes them a while to actually collect that $1,000 from the insurance company. Therefore, if you walked in and said, you know what, I want this procedure done, and I'm willing to pay $750 cash, they may take it. So these are things, all these things are out there that you should consider. What can you do to reduce personal health care costs? Straightforward. Eat more correctly. Keep your weight under control. Quit smoking. Don't drink to excess. All these things to, being moderate. Getting enough rest, relaxation, exercise. Driving carefully. Protect yourself from medical ID theft, which is unreal, the amount of medical ID theft that's out there, identification theft. Again, walking through the various summaries of what we covered before. I'm just going to go through these rapidly, just to to get through this. You can just glance at these as we go through, covering all the various objectives under Chapter 9. And that will wrap it up.